Mental illness is just that. It's an illness. It's not a moral failure or a character flaw, which a lot of times it's treated as.
Getting the right care for mental health concerns can be a complicated process. Finding the right insurance to cover the cost is an additional struggle for families.
And all this week, WBAL TV 11 News Investigates is looking at the various issues that people are facing in our series Costly Coverage Health Insurance in Maryland.
And despite laws mandating that mental health care be as available as physical care, families find help either out of reach or too costly to afford.
It's called Gallery. When I first intended to make it, it was I was just thinking about like coming out the hospital and then, just, I don't know, I feel like in the hospital it's just always you're being watched.
Artist Frida Kahlo said she didn't paint dreams or nightmares, rather her own reality.
It's kind of like your camera, actually.
The same can be said of 18-year-old Remy from Severn, whose brightly colored work depicts her darker reality.
This is lithium right here.
That's lithium.
This is lithium right here.
10 hospitalizations since the age of 14 for major depression with psychotic features.
I always felt really trapped and watched.
These days, thankfully, Remy is stable.
Finley, come here. Come here. Come here.
A relief to her mother, Joy, who lost the gold standard of health insurance when she was laid off from her job as a federal health care worker. A secondary plan through Remy's dad just doesn't cut it, and another hospitalization could be daunting.
It could financially break us. We would, we would definitely have to go through our savings. It would be extremely stressful.
Remy says her family is not alone.
I know a lot of people are out there. They're keeping all their issues to themselves probably because they know that it would set them or their family back financially.
Remy and Joy try to raise awareness, not just about mental illness, but the failings of insurance. According to a recent report, Maryland residents were nearly 21 times more likely to go out of network for inpatient behavioral health treatment compared to medical or surgical treatment, a rate that is more than 3 times the national average.
I saw how differently mental illness is treated versus a physical illness.
Mental health care can be unaffordable even if you have insurance.
The problem, according to the Mental Health Association of Maryland, insurance reimbursements.
The insurance companies are not paying mental health and substance use providers enough to entice them to join their networks.
And that has delayed so-called parity, which a 2008 federal law mandated so mental health services would be as accessible as those of physical health.
We're in the midst of doing a number of investigations on mental health parity and coverage in an effort to make sure that our health insurers are following the law. These are services that families desperately need.
For now, Joy is trying to help others who are walking this journey, volunteering with the National Alliance on Mental Illness. And both Joy and Remy are featured in a powerful podcast, You, Me, and My Mental Illness.
Mental illness is just that. It's an illness. It's not a moral failure or a character flaw, which a lot of times it's treated as.
Remy, who says she is not fully recovered, continues to find purpose through her art. Canvases that are not dreams or nightmares, but Remy's own reality.
She's been through so much.
Yeah.
And I'll tell you, I thank her for her honesty. She and her mother, Joy, it is very hard to go through what they've been through and then to go on television and share their journey to take the stigma away from mental health. Kudos and thank you to them.
And eye-opening, 3 times the national average
3 times.
financially could break somebody
I did
with your
not.
health care.
I was not aware of that. I
Yeah.
was not, and they're continuing to investigate to make sure that these insurance companies in
Yeah.
Maryland are doing what they need to do.
Sheesh.
So we want people to know there are resources if you need to reach out for help, including 988, and we have several other numbers and websites you can use and find on the WBAL TV app.
A great piece. Also on the app, you can find resources on how to appeal if an insurance claim is denied, as well as navigate finding a new doctor if yours recently went out of network.